Hey friends, Christie Amundson with Impact Physical Medicine here, coming at you back on our Impact Your Life channel. I am coming to you today wanting to discuss some considerations for nursing positioning. I am currently 9 weeks postpartum, and this is my son Dash, and he's going to be helping me out today. And not only with Dash being my 4th child that I have breastfed, but being a physical therapist, I work with a lot of women who are new moms and struggling with pain in their body, whether it be hip, back, shoulder, neck, wrist, wherever, and who are unfortunately not able to enjoy the nursing experience as much because of their symptoms. And we work through and problem solve their issues in the position for nursing, and a lot of times it can really change their nursing experience into a more positive one. So that's what we're going to be talking about today. So when you're determining what position works best for you, you want to look at 2 main things. Number 1, you want to make sure that your baby is in a position that they are comfortable, and more than that, that they can comfortably eat, meaning comfortably swallow. And number 2, you want yourself to be in a position that you feel comfortable, you feel supported, and that ultimately you can feel like your body can relax and enjoy the experience. This will not only facilitate a better letdown of your milk and improve your milk flow, but it also is going to help. Usually when you're nursing, it is for a period of time, whether that be weeks or months or years even, and you want to try not to facilitate muscular patterns that will potentially wreak havoc on you in the future. So if you think about if you're doing something, using a muscle erroneously that maybe doesn't need to be used, and doing that over and over and over multiple times a day for weeks or months or years, it can definitely pattern your body. And even if you're not experiencing symptoms right now, it can potentially be difficult for you in the future. So we want to avoid that. So in terms of positioning your baby, the main things that we want, there's kind of 2 main things that you want to look at when you're positioning for nursing, as well as maybe after you've got a good latch, just making sure you're kind of checking off the things in your mind. So those 2 things are going to be trying to keep their neck in line with their body. So in other words, they're not having to turn or rotate their neck a lot. If you were to turn your head all the way to one side or the other and try to swallow, you'll notice that it's much more difficult to swallow with your head in a rotated position versus if you were just to be straight. So you'll often hear people say, when you're positioning your baby, you want them tummy to tummy, but what you don't want is them to have to really turn their turn their neck to eat or get your nipple. So you want to turn their entire body when you're doing that, so that their head can just be in line with your body facing you or facing the nipple. The second thing is to promote ease of swallowing. You do have to have a little bit of neck extension, or basically like where your head tips back like this. If you think about, again, on yourself, if you tip your chin up a little bit and swallow, that's kind of normal. If you think about when we drink things, we often tip our head back. Now, if you try to bring your chin way down toward your chest and try to swallow in that position, it is relatively difficult or almost impossible to swallow in that position. So making sure that when you're holding your baby, you're facilitating a little bit of that head tipping back. A lot of times we try to direct the baby's head a little too much. And if you push too much on the back of the baby's head, again, that's going to try to tip their head down. That's going to, not only the baby has a reflex that's going to push back against you, but also it's going to be almost impossible for them to eat in that position. So if you make a C shape with your fingers and thumb, you place it on the back of their head, and then the heel of your hand is going to go between their shoulder blades. So it's like this, so you can kind of direct their head with your fingers and thumbs gently, but the pressure from your hand is going to come from the heel of your hand. And when you do that, you can kind of see with Dash here that he automatically extends a little bit Doesn't need to be a lot, but you do want a little bit of that neck extension, and that is going to help them be able to swallow. So again, while you're in whatever position that you're getting into, trying to facilitate these two things, trying to make sure that your baby is not turning their head a lot, and they're also allowed to bend their head back slightly. So while you're getting into the position, as well as after you get a good latch, just kind of double checking that and making sure that they're in the most comfortable position to facilitate kind of an easy swallowing experience. So we're going to go through briefly some of the different positionings, and we will kind of check that off. And then when it comes to we want to look at, usually I use the term, if you've heard the childhood song, head, shoulders, knees, and toes, right? I use head, shoulders, back, and toes as a kind of something that's easy to remember, that you can use as an analogy to whatever position that you're in, kind of double checking yourself and making sure that you're comfortable, you're supported, and you're relaxed. So when we talk about head, we mean your head and neck, and making sure that your head is in a position that it is supported, it's not really forward, it's not hanging down, and you're not having a lot of symptoms in your neck or head. Then when we move down to shoulders, we're talking about making sure that the shoulders aren't really rolling forward, or so where you're kind of almost like in a C shape. And we're also looking at, we don't want your body to overuse these upper muscles in your upper shoulder neck called your upper trap. It's really common when you're wanting to hold the baby to kind of lift your shoulder and hike your shoulder up like this. And this muscle is not needed for that. So when you're holding or nursing your baby, you want that muscle to be relaxed. So even just, again, when you're in the position after you got to have a good latch, just trying to be cognizant of, am I relaxed in my shoulders all the way? Back, so head, shoulders, back, and toes. So back is referring to both your lower back and your upper back, meaning we don't want to be in this kind of C shape where we're hunched forward. That's going to be problematic for your upper back and neck more. But we also don't want to be in a really overarched position either. Common problem we see is a lot of times people, when they think about, I need to support my back, they'll put a small pillow from like a throw pillow from the couch in just their lower back, and so it'll push their lower back into an arch, but not support anything in their upper back or neck area. So we want to try to avoid that. And lastly is toes. And quite simply, you just want to make sure that if your feet are anywhere, the bottoms of your feet are on the floor at all, whether it be in a sitting position or in a, if you're like up in a reclined position where your feet are up like this, then you want your feet to be flat. So you do not want only your toes to be on the floor, because that means that your calf muscles are not able to relax. So we just want your heels to be in contact with the floor so that your legs can be in a relaxed position as well. So whether it be you're sitting, you want your feet to be able to touch the floor and to be flat on the floor and not be up on your toes. But you also want your, if you're up in a reclined position with your knees bent, you want your heels to be in contact, and you don't want to be just pointing your toes down like this. All right, so we're going to go through briefly some of the more common nursing positions, and I'm just going to kind of problem solve with you what I see as the most problematic things and what we often kind of review in the clinic with our new moms. Okay, so the first position we're going to talk about is called the laid back position, also known as the recline position. It is great for right away when you first deliver. You can put the baby on your chest in skin to skin. And oftentimes if you are in like a hospital bed, you can recline the bed. If you have a reclining bed, or if you have a wedge pillow like this. If you also have a reclining couch, this would work. This couch does recline, although you can't really see the angles very well, which is why I'm going sideways. But so if you're lying down and you're going to put the baby on your chest on their stomach. So what you'll notice right away with this is the baby's already tummy to tummy, and they're going to have to lift their head up for that neck extension to be able to nurse, which is kind of checks off for the baby position. And as far as the mother, again, there's that head, shoulders, back, and toes that you're going to kind of check off in your mind. The worst, what I don't like about this position is, as you can see, my head, oftentimes when women nurse in this position, they're going to lift their head the entire time. So as you can see, my head is being lifted. The muscles in the front of my neck are staying engaged the entire time as I look down and not only make sure everything's going okay, but a lot of times I'll just keep my head up like this, which is not great to continue to facilitate your neck that entire time. It can cause pain, but even if it doesn't cause pain, it often will facilitate those neck muscles to stay engaged while you nurse, which we don't want to facilitate. So what I would recommend is, and this kind of goes for shoulders as well, is putting a pillow or additional support not just behind your head, because you do not want to just fill that space up and have your neck be forward. So what you want is the support to come from about your shoulder blade region and up. So that is kind of similar what we talk about when we push with the heel of our hand in between the baby's shoulder blades. When you get more support in your upper back, it facilitates a little bit more of that neck extension to keep your neck more in line with your torso, which is what we want. So if I lay down like this, again, I am going to, when I'm trying to get my baby to latch, I will lift my head. But then once everything is set up, I can relax down like this and enjoy the experience. You want to, again, kind of round robin and check that off. Check off that your neck is relaxed in this position. This is a better position for your upper back and lower back because they are in a supported position. Then if you move down, so shoulders, back, check, and my feet are better if you can bend them up as opposed to having them straight. But if I'm bending them up, I just don't want to be up on my toes like this. So keeping your feet flat down like this is preferable. So we're going to move on to the next one. Okay, so the second hold is called the Koala Hold. It is very similar to the reclined hold. It's basically the upright version of that. You'll notice I did put some pillows behind me because you'll want to be sitting upright, supported with your back with pillows. And especially so when I sit on this couch, even though I'm relatively tall, if I sit to the back of the couch, my feet don't quite touch the floor. So you do want your feet to be able to be flat on the floor. So in this position, you're going to have the baby straddle your legs facing you. You do have to, this works for some people, you have to be kind of match up correctly, the right height for the baby and the right height for the mom. And Dash and I don't really match up for this one, so we don't usually do this one, but it does work great for some people. Where you straddle, you have the baby straddle your leg, and they're going to face you and kind of sit on your thigh. And again, the baby's already facing you. The baby's already facing you, and they're going to get the neck extension as long as you're not pushing on the back of their head. So that's good. The problem I see with this often is if you kind of aren't fitting very well, then what often happens is the mother will arch their back and sit up to lift their breasts to make a better position. So you want to try to avoid that. You want your low back to kind of relax back, and if you need to lift your breast with your hand, that is preferable than arching your back and lifting like this with your back and with your shoulders. So again, head, shoulders, back, and toes. So your head is in a good position as long as you're upright. It's kind of balanced on top of your spine. Again, if you start to recline yourself, your head will feel the need to come forward, in which case you'll need more support on your head. The shoulders, for this technique, you want to keep them, make sure they're down. And you want your back to be well supported, both the lower back and the upper back. So again, you don't want to just put a pillow in your lower back where it's going to push you into an arch and not have any support for your upper back. And then last is your feet need to be flat so you're not up on your toes like this. That facilitates your calves to be tight. and we want your legs to be relaxed. So we're going to go to the next hold, and this is one of the most common is the cradle hold or the cross cradle, which I'll show you both. It's just a difference in hand position, but it's basically when they're laying across you. So I have a boppy pillow here. You don't have to have one of these. This is actually a nursing pillow that can be also used when your child lies on the floor. But you could use, I also have a pillow here. It's called My Breast Friend. This is similar to the boppy pillow. It just clips around the back of you, whereas this is more of just a horseshoe that kind of you just place. Whatever works best for you, and you don't have to have a nursing pillow. You could use just pillows from the couch. So you'll notice I still have the pillows behind me so that my feet can be flat on the floor. And what you want to do with the cradle is basically balancing their head in the crook of your arm, like this, and nursing. And when you nurse, this is the biggest, again, number one is you want to look at the baby's position. So it's very common. It's very common to have the baby be face up and to see them turning their head in this position. So this is one of the biggest mistakes. It's, again, really hard for them to swallow in that position. So you want to turn them so that their belly kind of faces your belly and their head faces here. So again, I could put their head in the crook in my arm. It kind of depends, again, on the size of the baby and the length of your arm and the size of your chest, if you are able to do this without hiking your shoulder. So again, if you are have to go like this, hike your shoulder to get the baby up, we would prefer that you use pillows instead so that you can keep your shoulder down and keep this muscle relaxed. So again, you're going to tummy to tummy, and then you're going to just make sure that their head is able to extend. So this cradle position is often better when they're a little older and they are better at latching. Initially, you may want to do cross cradle, which is basically taking your opposite hand in that C position, and you're going to grab onto their head, the back of their head. Again, the heel of your hand is between their shoulder blades, and you're going to facilitate that neck extension and help kind of steer their mouth over your nipple. A lot of times what I will do is I will use this position initially to get a good latch, and then I switch, because this can be really tiring for your wrist especially, or your arm on this side, versus just allowing them to just kind of rest in the crook of your arm. Again, you want to make sure, and if you have a pillow like this, or pillows from the couch, or a nursing pillow, you could also build the pillows up enough. I would need them a little bit higher, but that I don't actually have to put my arm underneath him, and I can be a little more hands-free, whether it be just to stroke them, or if I needed to do something else with, play with another one of my children or anything like that. So this is the cradle and the cross cradle. And then there's also the football hold, which is very similar, but you're just going to go, so if he's on his left side, nursing on my right, then he'd basically stay on his left side, but he'd nurse on my left. So I'd wrap him around this way. And it's called the football hold because it'd be like you're holding a football as a running back. I don't have a lot of experience with that, but you're going to hold him in the crook of your arm here. It's best if you can have pillows with this one. Again, you're going to see the C hold on this hand. And I can use my other hand to shape my breast to help with the latch. Again, I can keep my hand here, although this can be kind of tiring for people's wrists. So, oh really? So usually it's can be better if you can use pillows to prop up to help support. But again, watching, making sure number one, the baby is facing you, not having to rotate, allowing some neck extension. And then also for you, head, shoulders, back, and toes. So head, as long as you're in an upright position, is good when you're sitting upright because it can be bounced on top of your torso. You just want to make sure that as you're looking down and interacting with your baby, that your head's not falling down like this. Shoulders, the biggest thing in this position is making sure that you're not hiking up. And again, it can be really subtle. I was even doing a little bit right there. So sometimes you don't even notice it, and it doesn't have to look like this. But just doing this and taking your other hand and letting that relax can kind of help be a nice reminder. Your back needs to be supported not only from the low back, but also from the upper back. And then your feet need to be flat on the floor. Okay, so our final position that is commonly used is a sideline position. And this is great for nighttime feedings, or if you just want to really get in a relaxed position, you can lie on your side. I'm going to demo it on the couch. You can do it on the couch. It's a little bit more challenging. A lot of times people will do it in their bed. The one caveat I will say about this position is, again, you do have to kind of match up. Sometimes this is better if you really have a large chest, or the other thing is if your baby is struggling with a lot of gas or reflux, this isn't the best position, because it is better for them to feed where their head is a little bit elevated. And obviously in this position it is not. So as you're gonna set this up, you're going to lie on your side. I recommend putting a pillow between your knees. So that is kind of the component of the back for you in this position. So you're going to lie all the way down, and you want your head to be relaxed on, this is gonna be my pillow. And this is just a baby blanket that I rolled up, but you can put it underneath your neck to support your neck on the side here if you would like, if it's more comfortable. Dash is talking to you as well and trying to steal my thunder here. But what you're going to do again is you want to make sure that your baby is tummy to tummy with you, so facing you, as well as is allowed to extend their neck when they eat. So I would roll him toward me on his side when he does this, and he's going to feed from the bottom side. I can use my upper hand here to shape my breast, and I can also put a blanket behind him to prevent him from rolling backward. A lot of times that's what this hand is for, though, to prevent him from rolling backward. Oh, you want to sit? You want to see everybody? So the other thing when we talk about the mother, oh no, would you like to sit up, Dash? There. When we talk about the mother, you want to make sure again that your head is supported. You don't want your head really bent up, down, and you certainly don't want to be lifting your head up the whole time. You want I'm going to sit up here. With your shoulders, you want your shoulders to not, the main problem with shoulders in this position is having your top shoulder be really forward like this as you roll into them. So you want to make sure that as you lay there, that your shoulder can kind of be opened up and back. In your back, the main thing you want to do with your back is having the pillow between your knees and your feet. So not just between your feet, or excuse me, not just between your knees or your feet, so that it's both. And then your toes is kind of a non-issue in this position, because your feet you're not in a weight-bearing position with your feet. So you don't have to worry about your toes. And that is it. I hope you found this helpful. And if you did, please subscribe to our channel for getting new content. Hit the bell icon to get notifications for any of our new content. And we will see you soon. Bye-bye.